Coronavirus cases are spiking across the country among unvaccinated Americans as the Delta variant spreads. In Nevada's Clark County, cases have risen so high that they've been flagged as a sustained hotspot by the White House. The county's positivity rate is now more than 10%. And in Florida, Governor Ron DeSantis is focusing more on Dr. Fauci than his state's jump in cases. As his state reaches near the highest number of cases in the country, the governor is fundraising with these T-shirts that read, "Don't Fauci my Florida." Joining us now, pediatrician and president and CEO of the Robert Wood Johnson Foundation and former acting director of the Centers for Disease Control and Prevention, Dr. Richard Besser. Dr. Besser, I'm just reading a headline from The Hill, a former correspondent for E! Entertainment, I believe, who has contracted coronavirus again, being vaccinated, saying, "Don't let your guard down." Have we let our guard down?
Well, I think what we've reached is a situation where we're seeing a pandemic among the unvaccinated. And there are two courses in this nation. People who are fully vaccinated are protected against the Delta strain. That's the good news. But across the country, we're seeing a lot of people who are locked in their decisions. And it's been very hard to get people to move from a position of not wanting to get vaccinated to recognizing that the risk is still there. And that vaccination is the way out of this pandemic and back to the lives that we so much want to get back to.
So we have situations like the one in Mississippi where we were reporting yesterday that at least 10 children were on life support. So, I mean, is that something that should perhaps be assigned to those who are unvaccinated? I mean, if they are impacted politically about became vaccine hesitant, aren't we at the point where the science is proving itself to be correct?
As a pediatrician and a parent, I try to appeal to people in a number of different ways. We vaccinate to protect ourselves, but we also vaccinate to protect those around us who can't be vaccinated. So that includes all children under 12. That includes people with certain immune conditions. It includes people who've been vaccinated who have immune conditions who aren't protected because of that. It's critically important, though, that local governments, health departments don't let down the efforts to reach people. There are a lot of people with disabilities who are homebound, who need to have vaccines brought to them. There are a lot of people who are in lower paying jobs who still have challenges getting off work to get vaccinated. And so what I'm hearing from the efforts like these to reach people where they are is that slowly and steadily we're seeing an increase among those people who were on the fence, those people who wanted more information. And I do think that when the FDA finally decides on approval for these vaccines, we will see an increase among those people who really wanted to make sure that FDA had totally done due diligence.
Dr. Besser, it's Willie Geist. Good to see you this morning. I can imagine how frustrating it is for you as a doctor and a public health expert to see some of the politics behind this, talking about "Don't Fauci my Florida" and all that. I guess saying don't bring infectious disease expertise into my state. But we are where we are in this, and I think we have to come to terms with that. As you've said, the vaccine has been there. It has been readily available for anybody who wants it at this point, 12 years of age and older. And yet so many states have vaccination rates hovering around 30% or just north of that. So what does that portend if we're locked in, if we've hit our ceiling of who's going to be vaccinated in this country at this point? What does that mean for America for the next several months into the fall and turning toward the winter?
Well, I think we can't let down the effort. We have to continue with the effort. But, Willie, I think that we need to make sure we're not looking at this at the state level, that we're digging down more than that. So I'm here in New Jersey, and New Jersey has close to 70% fully vaccinated for adults. I'm in Princeton, New Jersey, and the rate here is 76% of adults are fully vaccinated. The next town over is Trenton, New Jersey. And there, it's only 44% of adults are fully vaccinated. So even though you may look at this at the national map and your state looks green, it looks like everything's going well. What matters is what's going on in your community and making sure that every community is reaching high levels of vaccination. Otherwise, this fall and summer in some places, as kids are going back to school, there's going to be increased risk because the Delta variant, while it's not more severe, it spreads more easily. So it's going to find those pockets in each community where people aren't vaccinated, and it's going to do a lot of damage.